Did you know that untreated AFib doubles the risk of mortality, including 5 times the risk of heart failure and almost 2.5 times the risk of stroke? Here's Dr. Dedric Clarke with more.
Atrial fibrillation is a cardiac arrhythmia in which the upper chamber of the heart goes from beating on average 60 to 90 beats a minute at rest to 300 to 500 beats a minute, sporadically and spontaneously. This arrhythmia is the most common arrhythmia in the United States, and it's the most common arrhythmia in the world. It is estimated that over 10 million people in the United States have atrial fibrillation, and that number is expected to climb in the next decade, up to 32% increase. It is estimated that 1 in 4 adults will be impacted by atrial fibrillation within their lifetime. Now, why is it important to address early intervention and detection? Well, atrial fibrillation is affiliated with certain symptoms. Those symptoms are, for some people, fatigue, palpitations, their heart is racing, shortness of breath, dizziness, lightheadedness, spontaneous feelings of anxiety. I cannot walk or exert myself like I used to. And for some people, what they're describing is that I just feel like I'm slowing down. Well, AFib is a progressive disease, so those symptoms I just alluded to will only get further along and more difficult to treat and control. There are also clinical conditions that are just as bad or even more insidious than those symptoms. Specifically, atrial fibrillation is associated with a 5 times higher risk of heart failure, a 2.4 times higher risk of stroke, and a 2 times higher risk of sudden cardiac death. All these things are present if left untreated. Now let's talk about how do you treat it. Well, atrial fibrillation is treated with medications, sometimes blood thinners, medications to control the rate so the heart rate doesn't go too fast, and medications to try to keep you in rhythm. Those are called antiarrhythmics. However, for patients who either cannot tolerate certain medications or have side effects of medications, and there's some patients who, even in spite of that, their atrial fibrillation is still progressing, there is a procedure called a catheter ablation. And what a catheter ablation is, it is a minimally invasive, safe, effective procedure that is designed to isolate the abnormal electrical signals that is triggering AFib from the normal conduction system of the heart, therefore allowing your heart to stay in a normal rhythm. The procedure is safe and effective, although like all procedures, there's an inherent risk, and you can talk to your doctor to see if you're a candidate of it. Johnson & Johnson has a comprehensive patient resources that allows you to learn more about this. You can go to getsmartaboutafib.com to get more literature and to discuss and see if catheter ablation is an option for you.